All right, good afternoon. Welcome to our quarterly University of Minnesota Horse webinar. My name is Krishona Martinson, and I'm the Equine Extension Specialist here at the University of Minnesota. Today we are really excited to have Dr. Alex Bianco. She's also with the University of Minnesota in the large animal medicine group. She also works at the Equine Center in the Piper Performance Clinic. And her expertise is in internal medicine, which encapsulates a lot of different topics, but she's also really passionate and knowledgeable about the care of geriatric horses, which is our topic today. I hope you all can hear me. It appears that you are able to get on just fine. We do have a chat set up, and the chat box is open, so I'm hoping that if you guys have questions throughout the webinar, you can type your question in there. If Alex happens to see it, she can answer it then, or she will answer all the questions at the end as well. So if you don't want to depend on your mind to remember your question, you can type them into the chat as we go. So with that, I'm just really excited to have Dr. Bianco with us, and I will turn it over to you.
Thank you, Krishona. Okay, so today we'll be talking about care of the geriatric horse. We're going to go through a few different aspects of that, so background information on what life is like for our horses today, and then go through kind of the three main topic areas of health care that are pertinent to the geriatric horse. So dental care, osteoarthritis, and then PPID, or pars pituitary intermedia dysfunction, which I'll just call PPID. And then kind of the big questions at the end, quality of life versus quantity, and how we make that decision to say goodbye. So there's a couple different definitions of age. So chronologic age is basically our true age relative to the calendar, relative to birth. Physiologic age kind of refers to our age in terms of our functional capacity. So unfortunately, a lot of us might be already past our prime in terms of our functional capacity. But and then demographic age is basically our age relative to our survival rates in the population. So for horses, we consider any horse geriatric if they are greater than or equal to 15 years of age. So we know horses live longer than that, but based on survival data, any horse over 15 is kind of considered in that geriatric or older horse group. And this definition is what we use in scientific papers and kind of as a general consensus in the equine population. So in the wild, our feral horses have a lot of challenges to longevity. So there's a limited habitat, and that leaves the horses at risk of feast and famine and overpopulation issues. Horses are prone to predation from other animals, and then a big component of their risk to longevity is they have no veterinary care. So a lot of the things that we provide for our horses, they don't get in terms of dental care, routine vaccinations, emergency care if they suffer trauma or are lame, or if they colic. So because of those limitations, survival data in the wild kind of looks like this on this graph. So on the y-axis up here, we have basically the chance of surviving to the next year, and on the x-axis, we have the age of the horse in years. So if we start here at birth to around 15 or 16 years of age, there's a pretty steady downward curve of the horse's chance of surviving to the next year. So your chance of surviving to the next year goes down a little bit every year, which makes sense. As horses get older, they're more likely to not survive. However, if we look at kind of age 16 onward, there's a drastic change in the slope of the curve. So it just means there's a lot less horses in the wild that are living each year. So down here, there's very few horses in the wild that are in their 20s. The modern domestic horse has a lot of advantages. So high level of nutrition is one aspect that we have done to allow horses to live longer. And if you go to any feed store, there'll be feeds for any life stage of the animal and lots of specialized feeds. And there's been a lot of recent research, and a lot goes into developing feed for horses now that definitely was not, definitely doesn't occur for horses in the wild, but definitely was not even available 50 years ago. Horses live in a safe environment. We don't really worry about predators for most of our horses, and that's another big component to why they can live longer. We have increased sentimental value for our horses. So it used to be that you had a horse so that you could earn money. Now we need to earn money so that we can afford to have a horse. With that, each horse has greater individual value, and we have a lot more sentimental value towards each of our horses. They're more like part of the family than they are livestock. Horses also have access to high quality veterinary care. So people like me and people who come out and work on the farm provide care on the farm, a lot of routine care that has also helped our horses to live longer. This picture is a horse of a mare named Belly Bump. She is in the UK and she's an ex-show jumper, and her owners set her up with a nice flat screen TV right in her stall. So she is definitely living the life. So because of these recent advancements, the modern domestic horse has a lifespan of closer to 20 to 30 years. And there's been more and more reports of horses living beyond 40 years, which is pretty impressive. According to the USDA, there's almost 4 million horses in the United States, and about 8% of these horses are greater than 20 years of age. So as of 2005, that was about 275,000 horses in the country. There's a few record breakers, which I just think is kind of fun to look at. So Shane, this horse here on the left, he lived to 51 years old. That's an Irish Draught. In the middle, we have a quarter horse Cactus who lived to age 50. Magic, last time I checked, is this Arabian was still alive and living in California. Donkeys and ponies also can live a long time. This is Rosie the donkey. She lived to age 54. And then Twiglet, last time I checked, was also still alive and living in the UK and still giving pony rides. So a lot of record breakers out there, and I think this will continue to be the trend that horses are living longer and longer. So with that, with all these older horses to care for, there are some certain aspects of veterinary medicine and horse owners that are really important to keep track of because they are special circumstances for horses as they get older. So dental care is a really important thing, and we're going to talk a little bit about anatomy of the horse's teeth, the dental disease that they can get, and then how you can keep track of your horse's dental care and recommendations. So the adult horse, so adults meaning over 5 or 6 years of age, have 4 dental arcades, and each dental arcade has kind of 3 sets of teeth. There's the incisors, which are in front. Horses have 3 incisors, and then if they are a male, they have a canine incisor as well. And then some mares you'll notice will have kind of mare canines, which are much smaller and less developed canine teeth. Then they have cheek teeth. So back here we call these the cheek teeth. So the first 3 are premolars. Some horses, if they have a wolf tooth, they'll have 1 premolar right there. So they might have 4 premolars. And then the back 3 teeth are the molars. So in an adult horse, they will have anywhere from 36 to 44 teeth. Horses have a hypsodont dentition. So unlike us as humans, we have a brachydont dentition. So this is a human tooth. This is what a horse tooth looks like. One unique thing is that their teeth continuously erupt over the course of their life. So unlike our teeth, which is what you see is what you get, horses will continually erupt their teeth over time as they wear them down. So this gray part here, this is all called the reserve crown, and it's all within the skull and ready to erupt as the horse kind of grinds down this occlusal surface. So this is just an image of a horse skull, and we can kind of see through the bones here. And what you can see in the mouth, that's the occlusal surface of the teeth. That's the part of the tooth that's currently in use and used to grind down feed. And then all of this up here is the reserve crown. And then at the very top, you have the tooth roots. So all of this, you can't see that. That's all within the skull. This would be a fairly young horse because you can pretty much see lots of tooth left to come out. An older horse will have a very, very small reserve crown, and this will all be not there anymore. So what can happen in geriatric horses? Missing teeth is a huge issue. So these teeth can be lost, whether they fall out due to infection, fracture, or trauma. This image, this picture, I took this of a girl who found her horse's tooth just in the pasture. It just had fallen out of the horse's head. And you can see that this is one of the tooth roots. This one is missing, probably because it was infected or fractured, and that's why it got loose and fell out. Teeth can also expire. So this is what we call it when basically the horse never lost the tooth, but basically all the reserve crown was used up. So that tooth is gone only because it ran out of tooth. This will happen starting in the late teens or 20s, but it can vary depending on which tooth it is and individual variation in the horse. A diastema is a gap between the teeth, and this gap they can accumulate feed material between those gaps, which can lead to tooth root disease and periodontal disease or disease of the gums. So this is an example. This is a picture of the inside of a horse's mouth. You can see here where this is like the top upper right, and this is the hard palate, so that's the top of the horse's mouth. So this first tooth looks pretty normal, but then what we see here is a diastema. So there's a tooth missing here, and it looks maybe like there's a piece of tooth right here, but then all this empty space is a spot where food material can accumulate, and this piece here may indicate a fractured tooth, so there might be an infection going on in here. This is common things that we see inside the mouth of an older horse. Another thing you might hear your veterinarian mention is a wave mouth. So a wave mouth is basically when there's a variation in the height of each tooth. And this can occur because if a tooth is missing, the opposite tooth on the top or the bottom, depending on which tooth is missing, the opposite tooth has nothing to grind against anymore, and so it doesn't get worn down with the same at the same rate as the other teeth. So this over time will become a wave mouth. So here's another side view image of a skull, and this is showing a couple different dental abnormalities. So we have a wave mouth here, and you kind of appreciate that wave. And basically it's saying that these teeth are no longer grinding down together at the same rate. And as over time, this will just continue to get worse and worse. We also see in the front here, we call this a rostral hook. If you have another one in the back, sometimes you'll hear this called a ramp. But those are sharp points that can also develop and cause problems for the horse. Tooth root infections are one of the outcomes of some of these conditions of missing teeth, fractured teeth, diastema. Bacteria are all over in the mouth normally, but usually when you have your teeth are intact and you have no gaps between them and you have healthy gums, that bacteria can't cause disease. But when any one of these other pathologies exist, the bacteria have a way to get in and cause a problem. So this can lead to missing, loose, or fractured teeth, more periodontal disease, and all kinds of unfortunate things for the horse. So if they get a tooth root infection, like I said, they can lose the tooth, they can fracture the tooth, but they can also get sinusitis, so an infection of the sinus. And this is because the upper cheek teeth, some of them have roots that communicate with the maxillary sinus. So these are the sinuses that are basically right above the teeth. And with that, so like in this case, you have a horse with purulent nasal discharge on the right side, and then when ultimately it was this tooth that was the problem. And again, you can see here's a normal tooth root. This one is missing, and probably because it was infected, and so that horse needed to have its tooth pulled. This is kind of a gross picture, I realize, but this horse, obviously, this is from a necropsy, so this horse did not survive. But this is looking at the horse's top teeth from the bottom, and this is the top of the horse's mouth. So what you can see here, this horse had severe dental disease, and it had never had a dental. And what you can see is that there's diastema here and a diastema here, and then there's gaps around between the hard palate and the tooth, and all of this is accumulated feed material. And this is a very large, basically, cavity full of feed material as well. So this horse had severe dental disease, and all these teeth were loose and needed dental care. So outcomes of unmanaged dental disease, so pain for the horse. If you've ever had a toothache or a sinusitis, that chronic pain can really be hard to deal with. If horses can't chew well, they can't swallow well, and so they can be at higher risk of esophageal obstruction or choke. Horses that can't eat effectively will also result in weight loss, and then overall just a decreased quality of life. So things that you can do is just keep track of when your horse needs an oral exam. So we recommend that all adult horses have an annual dental, at least an oral exam to see whether a dental is needed. Horses over 20 years old probably should have a dental or oral exam every 6 months because they are definitely at more likelihood to have started having more serious dental disease. Prevention is really the best way to avoid serious issues, and so keeping track of your horse's dental care early on is really important. A dental or oral exam should be scheduled at any time if you notice signs of potential dental issues, such as dropping feed. So this is called a quid, or if your horse is quitting, kind of dropping these chewed up spitballs of feed. If you notice that your horse is losing weight, has bad breath, or any nasal discharge, especially if it's just on one side. Another couple of things, the oral exam should be with sedation and using a speculum. As the one who has to stick their arm into the horse's mouth, I want to be able to do that safely, and that's really the best way for me to get a good feel of every tooth to say whether teeth are loose and whether I think that there is other disease that needs to be taken care of. Those cheek teeth, those molars are really far back in the mouth, and there's really no safe way to feel them without a speculum. Dental procedures themselves should only be performed by a veterinarian. Veterinarians are the only people that can legally diagnose and treat animal disease, and then veterinarians are the only ones that have access to appropriate sedation and other medications. They're also the only ones really trained and prepared to deal with a disaster or something goes wrong during a dental. That was dental care, and now we're going to move on to osteoarthritis, which many of you probably have dealt with personally or also in your horses. So just a quick overview, and then talking about management and then different medication options for osteoarthritis. So OA, osteoarthritis or OA, is a chronic, irreversible progressive inflammation of one or more joints, which leads to lameness and joint swelling and pain. Virtually all horses and people will develop OA during their life that affects at least one joint. This can be because of injury, because of genetics and poor conformation, and also just normal wear and tear. Things you can do to help manage your horse's OA. Monitoring their pain level is important. So if you personally have arthritis, like I do, there are good days and bad days. It might be because of the weather. It might be because of, you overdid it one day. But keeping track of what you think makes your horse better or worse will help. Exercise. It's been found that consistent exercise helps keep those joints feeling good. This might mean every day. It might mean kind of making any changes gradually. So if you want to increase their work level, doing so at a very gradual pace. Weight management is also important for overall health, but especially for joint health, because the more a horse weighs, the more stress they have on each joint. We prefer as veterinarians that a horse is a little underweight rather than a little overweight because it's better for their overall health. So we aim for a body condition score between 4 and 5 out of 9. Creating a comfortable environment can help with your horse's pain level. So avoiding concrete areas where the horses tend to stand for long periods of time. Providing a safe place for the horse to lie down. Horses are very sensitive they still have that predator-prey instinct where they will not lie down if they feel they potentially are not safe. So even if they hurt, they won't lie down unless they feel like they have, appropriate shelter and that there's pasture mates who are keeping watch while they take a rest. And then maintaining healthy feet will also help your horse. So having a good relationship with your farrier and having a good relationship between your farrier and your veterinarian can be very helpful. So lots of medical options for OA. So targeted therapy means treating that joint specifically where the disease is. This can be through joint injections or, and then in some cases of kind of end stage or severe disease, surgery can help to kind of fuse the joint either with an ankylosis or an arthrodesis. Supplements, there are a lot of supplements out there. Very few have really been shown to be effective, but most of them probably won't hurt. They may or may not help. A couple that have a little bit more research behind them are omega-3 fatty acids, which a lot of people out there are taking fish oil. They make omega-3 fatty acids specifically for horses now. Glucosamine and chondroitin, so this is like cosequin, and then the polysulfated glycosaminoglycan, that's your adequan. Those have a little bit more research behind them that they potentially can help horses with OA. Non-steroidal anti-inflammatory drugs, or NSAIDs, this includes your banamine, phenylbutazone or bute, and then firocoxib, which the products are Equiox for horses and Prevacox for dogs. These should be saved for short-term use. So NSAIDs are helpful during flare-ups, so you kind of want to do a 3 to 5 day course if your horse is having a flare-up of their arthritis. Equiox, or firocoxib for horses, is labeled for a 14-day course, so a little bit longer use there. And then Prevacox is not labeled for use in horses, so it is the same drug, but that's the dog version. Diclofenac or Surpass is a topical NSAID that's used kind of as a absorbed through the skin if you put it over the joint directly. It is important to realize that NSAIDs have serious risk of adverse effects, so they can cause stomach and colonic ulcers and cause renal failure. And that daily NSAID use should really be reserved for end-stage disease, those cases where all other options have failed and you're just trying to keep your horse comfortable and have good quality of life, knowing that if they develop side effects, then you might have to make a hard decision, but at least your horse is comfortable in the meantime. Okay, next topic we're going to cover is pars pituitary intermedia dysfunction, which we will just call PPID. So we're going to have the overview, clinical features of the disease, how we diagnose it, and then management. So PPID used to be called equine Cushing's disease. Some people still use the term equine Cushing's disease because PPID can be a little bit of a mouthful. It may affect up to 20% of geriatric horses. I think that probably underrepresents it, but it's very rarely diagnosed in horses less than 10 years old. So it really is a disease that's specific to geriatric horses. And as horses live longer, we're going to see it more and more. One of my people that I used to work with, who's one of the endocrinologists, she basically said that all horses, if they live long enough, will probably develop Cushing's or PPID. So PPID is caused by a pituitary adenoma, so it is a non-malignant growth in the pars intermedia of the pituitary gland. So it's not a malignant tumor, but it is a tumor. And the pituitary gland is a small gland that's on the underside of the brain. So you'll have heard of Cushing's disease in people or Cushing's disease in dogs. That type of Cushing's is very different in terms of what causes it than the horse condition, which is why we've switched to calling it PPID versus Cushing's, because it is very different. But this adenoma, basically as it gets bigger, it causes disruption of the normal pituitary gland function. And specifically, it causes decreased dopamine regulation and an increase in something called adrenocorticotropin hormone, or ACTH. So ACTH is an important thing in the normal horse because it is one of the hormones that stimulates the production of cortisol. Cortisol, you've probably heard of it, but it's our stress hormone. And you want, when that stress hormone is high, it helps the horse get ready for winter. So if you have ever been under stress, you might feel like you put on weight, you're growing hair. That's normal. As part of that, it gets the horse ready for winter. They'll increase their fat storage, they'll grow a thicker hair coat, and be more prepared to make it through the winter. So that's what happens in a normal horse. In a horse with PPID, because they have this tumor, they produce the ACTH inappropriately. So they have an overstimulated stress response. This leads to insulin resistance, abnormal fat deposition, abnormal hair growth, and overall immunosuppression, or a decreased immune system. So clinical features, one of the things they found is the most consistent sign of PPID is hirsutism. So that's long, thick hair coat. And delayed shedding. So long, thick hair coat in an inappropriate time. So a horse that doesn't shed out its winter hair coat, or a horse that keeps its winter hair coat into July, even in Minnesota, that is not normal. So paying attention to that. Recurrent infections is also something that we notice, and this is due to the immunosuppression. So horses with PPID are at higher risk of developing foot abscesses, tooth root abscesses, and then things like rain rot. Poor body condition is something we also notice because when your stress hormones are high, you're more likely to put on fat, you stop putting on muscle. So horses with PPID will oftentimes lose their muscle mass, so we'll notice muscle atrophy. Horses with PPID are not generally fat, however, they just might have fat deposits. So they might have fat deposits over their eyes, their neck, like a cresty neck, or their shoulder, but they're not generally fat unless they have another disease at the same time. Another clinical feature of PPID is laminitis, and this is often the most significant life-threatening complication. So laminitis refers to rotation and or sinking of the coffin bone within the hoof. So this is the third phalangeal bone or the coffin bone. Laminitis causes a lot of pain. It can be acute to chronic depending on time course of disease, and the pain is localized to the toe. So the front feet tend to be affected more than the hind feet, but this is a cross-section of a foot that is, obviously this horse did not survive, but right here, this is the bone, the third phalangeal bone, or the coffin bone, and then this is the hoof here. So we're looking at this in cross-section. And as you can see here, this third phalangeal bone, the point of it is coming down through the bottom of the foot, so the horse's sole. It should be parallel to the hoof wall right here. So this is one of the reasons why it causes such severe pain, is that bone is trying to come down out the bottom of the foot. So laminitis, a really important thing to realize is that prevention of laminitis is key. Once a horse develops laminitis, it can be very difficult to control progression of the disease, and that can require intensive management between you as the owner, your veterinarian, and your farrier. We diagnose clinical PPID based on clinical signs. We would have suspicion based on, your hair coat not being lost, loss of muscle mass, age, all those things we talked about. More definitively, the first test we do is a blood ACTH level. This can be performed at any time of year. When it first came out as the test of choice, we thought that we couldn't test it in the fall because horses naturally had a fall rise. But now that we have been doing this test for more years, we've come to the conclusion that it actually is a good time to test, because horses with PPID, they'll have a much more significant fall rise than other horses. Other tests where we clinically suspect it, but maybe that blood ACTH is normal, is a stimulation test. So TRH stimulation is the second test of choice. The dexamethasone suppression test was kind of the original test we used to test for PPID, but it's rarely performed anymore, and it's not really recommended because it does have some risk of adverse effects. So if you want to test your horse for Cushing's or your veterinarian suspects PPID, blood ACTH is the test of choice, and then if you need to, a TRH stimulation test. There's no cure for PPID because that part of the brain is not accessible by a surgeon. You can't remove the tumor. It doesn't spread to other organs or anything like that, but it will continue to grow over time. And as it gets bigger, it can basically worsen the signs of the disease. So it's important also to keep track of the secondary infections that could occur. So that means examining the hair coat for rain rot. It means keeping up to date on their dental care, knowing the signs of dental disease, and then keeping up to date on their foot care. So know what a hoof abscess looks like, know the signs of laminitis, so that if you notice any of those things, you can have it addressed promptly. A specific treatment does exist. So Pergolide is the drug of choice, and it comes in, we do have an FDA-approved product for horses called Presend. So we don't recommend specific products for everything. This is a disease where there really only is one product that has the FDA approval and is effective for treatment of PPID. So this product, it helps dopamine to regulate the ACTH production. So it's basically mitigating the clinical signs of the disease. It's not treating the actual growth. So the growth is, the tumor is still there, but this will help decrease the clinical signs, and less clinical signs means that the horse is no longer at as high a risk for secondary infections and things like laminitis. Oh, sorry. An important thing to realize there is that treatment is lifelong. So that because the tumor doesn't go away, horses, once they're started on Pergolide, they need to remain on Pergolide for life. It does require periodic retesting to see how well their PPID is being managed, because like I mentioned, the tumor keeps growing, so oftentimes the dose needs to be adjusted as the horse ages. Diet is an important component of managing a horse with PPID. So horses with PPID have insulin resistance, and this is something that there can be some confusion, because another syndrome we often talk about is equine metabolic syndrome. Those horses are younger typically, and they have generalized obesity, so they're easy keepers. They also have insulin resistance, but they are different syndromes. Some horses have PPID and EMS at the same time. So both conditions cause insulin resistance and will require, that's why they both can result in laminitis. So horses with insulin resistance need a diet low in non-structural carbohydrates, So this typically means that no grain. And grass pasture, sorry, I left off a sentence there. Grass pasture may not be enough may not be appropriate for these horses because of the sugar content. Oftentimes these PPID horses are not fat and they need additional calories, so we add those calories in by adding fat supplementation specifically. So increasing calories with fat and not starches. Okay, so the last topic we are going to cover here is quality of life versus quantity, and kind of figuring out, we're doing all these things to care for our older horses, but how do we know when it's time to say goodbye? So this is really where you come in as an owner, is that you know your horse better than anyone, and a lot of times we're making decisions based on your horse's quality of life and attitude. So is your horse still interactive with you, with other horses? Does your horse still look forward to meals? Those types of things that you can really assess better than your veterinarian. Another thing to ask is, can you meet the needs of your horse? So all of the things I've talked about are, expensive. They can be expensive, they can be difficult, they are extra work for you to maintain all these things. So we need to think about managing chronic pain. These horses might have special dietary needs. You might be talking about treating PPID and the secondary complications that go along with PPID, and you have to keep on top of regular dental and farrier work. So these things can add up, and these things are all prolonging the life of the horse. The better you are at all of these things, the longer you'll be doing them, which is, for many people, it's totally worth it, but for others, that can be difficult. That can be a difficult commitment. If you can't meet the needs of your horse, that's okay, but we need to consider the quality of horse's life. So not meeting those needs is to think about whether it is, if you can't meet the needs, then it might be time to euthanize the horse. If you can meet all the needs, there still might reach a point where everything you're doing is not enough to maintain your horse's quality of life. So I recommend making a kind of horse hospice plan with your veterinarian. So hospice is not something we talk a lot about with large animals, but I think it is important because it's a critical part of human health care. And as our pets are living longer, and as we have closer emotional relationships with our pets, I think it really is something to consider talking about with your veterinarian. So as part of your horse hospice plan, I think it's a good idea to review your horse's overall health and identify kind of problem areas and things that we're kind of maintaining. I think it's important to make guidelines for euthanasia and kind of think about these things before you have to make them in a highly emotional state. So having a set of guidelines that are specific for you, your scenario, and your horse. So I will choose to say goodbye if, and then making, statements such as, my horse colics and needs surgery. That's a sign that, I'm going to euthanize the horse. Or my horse no longer greets me at the pasture gate. my horse has trouble getting up, or my horse can no longer keep right through the winter. Those types of examples are things that to think about. Anticipating possible scenarios will also help. So like I mentioned, you don't want to have to be making difficult decisions at 2 o'clock in the morning when your horse is colicking and you've not even thought about what will I do if that happens. So think about, all these things that we mentioned. So older horses can colic. Older horses, what do I do if my horse does develop a sinusitis? Am I going to pursue treatment of that? If my horse does develop laminitis, am I going to pursue that treatment? So thinking about those things ahead of time so you don't have to make them if in an emergency situation or when you haven't really done the preparation that you need. All right, so that's my presentation. So now I think we can go to questions.
All right, sorry, hopefully you can hear me. Alex, I've gotten a few questions privately, and that is just a reminder to please, when you ask a question, you can put it to everyone so that everyone can see it. If you want to send it privately to me, that is perfectly fine as well. Alex, the question here is, are there any other diseases or disorders that we should be aware of in our older horses?
Okay. So older horses are not immune from all the other diseases that horses can get. So anything that a younger horse can get, an older horse can get too. It just tends to be that these specific things are more frequent in older horses and maybe have more complications than in other horses, if that makes sense.
So another question I have gotten is, should older horses who are no longer traveling still be vaccinated?
That's a good question. So the problem is that even if your horse doesn't travel, things will still travel to it, such as mosquitoes or bugs in the environment. So a lot of the things that we vaccinate for are actually carried by vectors like mosquitoes, such as West Nile virus. So if your horse lives in Minnesota, for example, it is going to see mosquitoes, and those mosquitoes could have West Nile virus. Like with tetanus. So there's tetanus everywhere in the environment. There's tetanus everywhere in the environment because it lives in the soil. So that's one of the most important vaccinations we have for horses is tetanus. And that is something that traveling will not prevent your horse from being exposed to that. Other things are risk-based vaccines, such as influenza and rhino, so our flu rhino vaccine. That is considered a risk-based vaccine that they get from other horses. So if they don't travel, that might be one to talk to your veterinarian about as whether your horse needs that or not. But the core vaccines really should be given to any horse because they come from the environment or insects, not other horses.
All right, Alex, you have one question here. What is a good feed for a 26-year-old horse, and how do I treat diarrhea?
Okay, so a good feed for a 26-year-old horse depends on that horse's overall health, and it really depends a lot on their teeth. So if they've got good teeth, there's nothing wrong with that horse eating hay or eating grass pasture. Oftentimes, though, at 26, they've run out of teeth, so a lot of them have expired. So even though they might enjoy chewing on hay or grass, they don't often get enough calories that way. So they've developed a couple unique feeds for the senior horse. So seems like Purina makes one, Nutrina makes one, called a senior feed or a complete feed for senior horses. Those can be good as either as a solo feed if the horse can't eat hay at all, or as supplemental feed to their forage because they're completely balanced for that meet all the needs of that horse. So something to talk about with your veterinarian or nutritionist, and just kind of take a trip to the feed store and kind of look at what is out there for older horses. Oh, and how do I treat diarrhea? That is something that really depends on your horse and everything else that's going on with it. I would recommend that's something to talk about with your vet because they will know more details about your specific case, and they'll be able to look at your horse.
Okay, Alex, the next question is, can mild laminitis be reversed?
So it depends on the type of laminitis. So Laminitis, if it's caused by something like PPID, a big part of how we would basically hopefully stop the progression is by getting on top of the PPID. So treating the underlying cause, treating the PPID with pergolide, and then addressing the diet, because the insulin resistance is a big reason as why those horses are developing laminitis. So the goal is first to stop the progression, and then the reversal basically is has to do with the farrier and working with your farrier and your veterinarian, because what you're trying to do is basically let the foot grow out and reshape the angle of the foot relative to the bone. So that takes a lot of time, but the first step is really trying to just stop progression and then kind of work on whether you can reverse the damage as they go.
All right, I will give everyone just a few more minutes to ask additional questions of Dr. Bianco. I think she did an excellent job talking about a really common scenario that a lot of us have, these older horses that we're trying to care for and do the best by, and what are some of these scenarios that we experience. So I do have another question that was sent. How do herbal supplements how do herbal supplements compare to prescription treatments for PPID? And the herbal supplement, one of them is called Remission, and one of them is spelled H-E-I-R-O.
Okay. I'm not familiar specifically with that the second supplement you mentioned, but they have done a few studies looking at supplements for treatment of PPID, and they have been shown to not be effective. It doesn't mean that they are necessarily unsafe. So if it's something where you feel strongly about trying it in conjunction with pergolide, that's something to discuss with your veterinarian, but probably isn't going to hurt anything. But nothing has shown to be effective for treatment of PPID besides pergolide. That is really what your horse needs if they're doing it.
Okay, once again, I will do last call for questions. Also, just to let you know that this webinar has been recorded, and we will post it on our YouTube channel and also on our Facebook page so that you all can come back and reference it later on. So, seeing as there are no additional questions, I just want to thank Dr. Bianco again for talking about this really important topic. And I want to thank all of you for taking time out of your day to join us. Okay, we have one more question.
Oh, let's do that.
All right. 16-year-old halflinger that has a tendency to have laminitis and also has a thick coat, slow to shed, which she knows is Cushing's, or she thinks is Cushing's. Should she test her for Cushing's, and what is that process?
Yeah, so that's a great question. So it sounds like your horse definitely would be worthwhile testing for Cushing's, especially that we're still in the fall, so it's a good time to test with just an ACTH blood test. So that's something that your veterinarian can do on the farm. All they need to do is come out and draw blood. It's just one blood tube, and then they send it off to be tested. Only a few, not all labs test for ACTH. It has to go to a special lab, but it can be easily done on the farm. You don't have to do anything special, but coordinate that with your veterinarian. So it's definitely good. It sounds like, you know, those kind of things that you mentioned, thick hair coat, slowing to shed, being prone to laminitis, those can definitely be signs of PPID. As a halflinger, you also would be a breed that's considered high risk for having equine metabolic syndrome, so that they might have two things going on, which would be two things that potentially can cause laminitis. So definitely would be worthwhile seeing whether treatment for PPID would help your horse.
All right, we will officially end the webinar here. Thank you again, everyone, for joining us. And like I said, this will be recorded and later posted online. So thanks again.
Thank you.